Dr. Amy Acton, thanks for joining us on Prognosis Ohio, and it's an honor having you in the WCB studios here today.
Thank you. It's an honor to be here with you, Dan.
So there's a lot to talk about, but let's focus in on a couple key parts. It's been more than 3 years since you stepped down as director of the Ohio Department of Health, and I hope you've had some time to reflect and process, even though that work is probably still beginning in many ways. But I want to ask you, what can you see now about the first few months of your work during the COVID-19 pandemic in particular, with proverbial 2020 hindsight, that you couldn't fully see then?
That is just such an interesting question for me. You know, my work on COVID actually began in very end of December 19. Folks don't realize, I think they got to know me around March, but we really had recognized something big was coming in January. So that 6 months of running that beginning of the COVID response, it's etched in my brain in a way almost hourly. It's so strange. And then time after that, these 3 years have been, when you say 3 years, I can hardly believe it. Yeah. And there's so much history there. That's why I've been a big advocate for why we need to study it. But I can tell you that I'm learning new things every single day, things that happened back during that period, a better understanding of things going on globally. I think it's almost like a big puzzle, and more of the science comes out, more and more analysis like you have done in your book that even fills out the picture for me more. But I don't think I will rest or fully understand everything I experienced until there really is some sort of formal 9/11 style commission, which so many have been asking for, sort of an after-action report, which hasn't happened yet.
Who should do that? I mean, who would be the appropriate body, or what would the appropriate body be to do that kind of work?
It really should happen both at the national level, at a global level, quite honestly, but at a national level for sure. And there are many, some senators have introduced bills. It's still a highly politicized topic, but I think we are at risk of losing so much if we don't pause to take a deep reflective look back. Many people don't know that there was a pandemic playbook, and it was created by George W. Bush after 9/11. He read John Barry's book, The Great Influenza, the study of the 1918 pandemic. And Homeland Security realized that the gravest security risk to our country, like if you took the virus and the death and disease aside, the gravest security risk to our country remains a pandemic or biologic weapon. And this playbook was passed from president to president. That's what you saw us executing here in Ohio. And I have so many thoughts, both from what we learned, finally implementing it, but so many more things I would add to make it different. And many of us would give as feedback. Here in Ohio, we need to do that. It's of note that I've never, ever, even during the pandemic, was not brought in to testify or since to really analyze what happened here in Ohio. So I think in Ohio, when the dust settles a little bit and it's a little less political, I would highly recommend we stop, pause, learn. There's actually many amazing innovations we did that we also at risk of losing.
Yeah, and if we don't document these things, we lose them. It strikes me, during the pandemic, while you were busy doing your thing in those months, we had Rick Hodges, your predecessor at ODH, on to talk about the Ebola moment. And really, Rick's, by his own admission, it was kind of a moment compared to COVID-19, but yet we learned a lot.
Yes.
And, the ability to learn and then build, probably made a difference in where we were at that moment. And yet, again, we're going to talk about this in a moment, but missing opportunities to learn are really unforgivable when we have such high stakes in public health.
Yes. And as a nod to Rick Hodges, the former director of the Ohio Department of Health, that, I think it was a 3-week period. People don't know that. We had a little Ebola scare in Ohio, a woman coming back from having worked in Africa, lived in Texas, but came home to Cleveland to try on a wedding dress. And we went into an emergency operating mode that we have for disasters in the state. People don't know there's a hidden little bunker that looks a lot like a NASA kind of place.
Yeah.
And I remember when I was onboarding for the position, the staff talking about, oh my gosh, those 3 weeks, you're in this bunker with windowless rooms, you're in high stress situation. We were in that mode for at least 6 months.
Yeah.
So you try to see the effect on the team, all the while trying not to get the disease so that we could keep running the emergency. It is an unprecedented war.
Yeah.
Basically a war.
Yeah.